Hi, my name's Dr. Duncan McCollum. I'll be going over with you how to reduce what's called a hiatal hernia. Now, if you have had a hiatal hernia, you'll know that you want to learn how to do this. Basically, what this is when the esophagus, which is the tube you swallow through, goes down and reaches the stomach. It goes through this diaphragm or this ligament type material that separates the lungs and the heart, called the vitals, from the digestive organs below, called the vittles. So as this tube goes through, it has to go through a hole in the middle of the diaphragm. When you have a hiatal hernia, it's happened either by injury, by accident, toxic poisoning, drug problems, whether they're pharmaceutical or street drugs, chronic inflammation, infection. So many things can damage the tissues of the not only the stomach, but the esophagus itself. So the esophagus pulls up into the vital area, and that causes all kinds of problems. Some things that you may not be aware of, that it could be chest pain, severe heartburn, of course, makes sense, or abdominal pain, frequent bloating or burping, difficulty swallowing can be a part of it too, because sometimes food gets stuck in that hiatal hernia right at the top of the diaphragm, and you can't get it through. So people regurgitate that up. You can get burning in the throat because the acids in your stomach are regurgitating up in there. Instead of digesting your food, they start to digest the inside of your throat, which is not very comfortable. So you can get nausea, and even chronic coughs can be related to this thing called a hiatal hernia. So I'm going to show you a picture and explain what it happens and then what we can do about it. So this is a picture of this would be the diaphragm. This is your esophagus, the tube you eat through. These are where your lungs and heart are. And then below the diaphragm, we have the vittles, which is the stomach. The pancreas goes across here, the liver, your kidneys are in there, your gallbladder, all kinds of vittal type things. Now, this is normal, but with a hiatal hernia, you see the stomach protrudes up above the diaphragm, and then everything spasms, and food can get stuck in here. It can cause a lot of discomfort, and it can become problematic, not only just for your symptoms, but it can be actually turn into a disease in itself. So we will show you how to reduce this. So there's 3 different ways to pull it down. And as we're teaching you how to do this, remember that we have to get to the upstream cause. This is a symptom that was caused by something. And if you're working with Dr. Pompa's group, then you're going to be able to find out what is the upstream causes of this so that you can be sure to get rid of them. Okay, so we're going to go through that. But another thing to be aware of is no matter what, if you're having problems, we want to look to the spine. Because as you can see, the nerves in the mid-back have a lot to do to control the stomach itself, the gallbladder, as well as the heart and lungs above it. But if the nerves going to that part of your body are not working well, they're kind of diminished, then your body can't function well. So chiropractic is going to find those areas of what we call subluxation or pinched nerve and turn them back on. So it's really important that you find a chiropractor or get a referral to one by the person you're working with. Another thing to be really aware of is the very top bone in the neck is the nerve that becomes the vagus nerve. And I'll turn this off for a minute. You can see how it lights up all of the organs in the body. And if we look over here, you can see that it comes down through the upper part of the system in the neck and can cause all kinds of problems because it will affect the diaphragm as well. The nerve comes down, the phrenic nerve comes down and helps the diaphragm work well. So if that's not working up at this part of the spine, if that's not working here, no matter what we do, you're still going to have a problem. So it's a perfect storm that created this kind of thing, and we need to unwind it. So there's all kinds of ways to do that. Remember that the hiatal hernia is a symptom of something else wrong. So let's make sure that we know how to help the symptomatic problem, but get to the upstream cause so you can get the best life you have opportunity to get. Okay, thank you very much. And we're going to go ahead and show you those 3 ways to reduce a hiatal hernia now. Thanks. Have a great day. All right, I'm going to show you 3 different ways to reduce a hiatal hernia. So as I was explaining earlier, the diaphragm separates the vitals from the vitals. The vitals being the heart and the lungs, the vitals, the stomach, and all of those organs down below. So where that esophagus, or the tube you swallow through, comes up through this thing called the diaphragm, when that hiatal hernia occurs, that gets pulled up through the hole, so you have more above the diaphragm than you should. So we're simply going to grab it and pull it down, assisted by the patient's breathing. So I'm going to go right to the xiphoid process, which is that bump you feel at the end of the breastbone, right below it. I'm going to dig in a little bit and have the patient take in a deep breath. And now I'm going to push and have you let it out. I'm going to not let up, have you take a deep breath in again and let it out. I'm going to push a little bit more. Deep breath in one more time and let it out and push it down. So I'm basically grabbing the esophagus and pulling it down each time she takes a breath, and that diaphragm's going up. So this is one effective way. Sometimes when it's difficult, you might have to do a little pushing or jerking on it. So that's method number 1. Dr. Pascal is going to demonstrate method number 2.
Okay, for our second method to reduce a hiatal hernia, we're again going to use the patient's breathing. We're going to use the pressure associated with the patient's breathing in the thoracic cavity to reset this association between the esophagus, the stomach, and the diaphragm itself. So for this, we're going to have, in this case, the patient protect breast tissue because we need to contact on the sternum. And what we're going to do is we're going to have the patient take a deep breath. As she lets it out, I'm going to apply force. So she's going to exhale all the way out. When we get to the bottom, she's going to inhale quickly, rapidly through her mouth, get as much air as she can. When she's about a third of the way through that inhalation, I'm going to get out of the way. What that's going to do is going to give a rapid expansion to the rib cage, and it's going to kind of snap that diaphragm up. And since the stomach, which the esophagus becomes, is anchored, that will stay in place and will reset that diaphragm upwards so the stomach isn't herniating through that diaphragmatic hiatus. So again, protect yourself, take a deep breath. Good, let it all out, all out, all out, all out. And now breathe in like you never have before, perfect. A lot of times we'll hear that kind of double clutch in the breath, and we got a good reset there.
Okay, so the third way to reduce a hiatal hernia is to first drink 16 ounces of water, as much as you can tolerate comfortably, and then you do this. You use gravity, and that water will pull the stomach down and pull the stuff that's protruding up through the diaphragm down, and that can reduce the hiatal hernia for you. So there's 3 different ways to do it. You can obviously do this one yourself, and the others, usually you need somebody to assist you with it. So hope that helps. Thanks.